Thank you so much. I'm going to go ahead and share my screen. So I kind of named this presentation Weaving Evaluation Methodology Throughout the Hospital because I really, I sit in a unique position to kind of see a lot of different groups and projects work together. And so I think that's kind of how I just envisioned it. So here's what we're going to be covering today. First, I'm going to give you kind of a lay of the land of Lurie Children's, some helpful infrastructure, just to sort of orient you that will help later on in the presentation, then really explain how we have woven things together from like a teaching perspective and learning perspective, and then give you some kind of practical concrete examples, and then really talk about where we're kind of going next. So first we can talk about Lurie Children's. And so we are located in Chicago. We are just north of downtown, so very much still very, very urban. We have about 8,000 employees, and here's just some kind of important facts and things to know. We have 364 inpatient beds, 10 primary care locations, 17 outpatient locations. So those are like specialists, like orthopedics and other things like that. And then we partner with 10 hospitals in the region. So we might staff their emergency rooms or have some surgeons that work there. So our breadth is pretty wide. We're not alone in Chicago as a children's hospital. There are a couple other ones, but we still see about 250,000 patients a year, and we do grow that every year. That translates into about 900,000 outpatient visits of all types, so those specialty and those primary care. About 60,000 emergency visits. We do have immediate cares also, so those are included in that. And we end up with a little over 10,000 patients as inpatients every year. So we're not a large system by any perspective, but we have grown a lot over the years, which does kind of make things a little interesting. So here's what the infrastructure I wanted to kind of share with you. So first of all, data analytics and reporting. This is the department that I sit in, and we are responsible for managing kind of our data platform that we use for reporting and for dashboarding and creating metrics, as well as other analytics and statistics throughout the organization. We also, and this is especially my role here is very new, as the Senior Director of Data Literacy. And so one of our other goals really is to foster a data-driven culture around the hospital. So not just in our org, but around the hospital. So that's been very exciting. A lot of work going on, and I'll touch a little bit on that at the very end. Also, I'm not going to talk a ton about research, because that to me was a little like a lot of like the research and evaluation overlaps are a little bit more from a practical perspective. But one of the areas of our research institute does a lot of program evaluation, not just for research sake. And so I did want to mention that, and it's pretty broad what we cover. Really the area that's the most connected to program evaluation is that community population health and outcomes pillar. They are the ones that focus on that. And then I'll talk a lot about our Center for Quality and Safety, because that's a lot of the weaving and overlapping. And really the goal of the Center for Quality and Safety, they focus on quality improvement, process improvement, and we are tightly aligned with them. The other thing, they are very much the champion of our institution becoming a high reliability organization. And really the idea behind that is driving to zero harm. Like there are hospital-acquired infections, like all types of things. And the goal really is to have no harm. We'll talk about that later for sure, because there was actually an evaluation done of that initiative. I'm not going to read all this because it's a lot of words, but I did just want to say that we do consider ourselves a learning health system. And this is one way I do see a lot of overlap. And where evaluation comes in, especially those bottom two, right? Capturing, analyzing data and care experiences to sort of show how changes can be made to improve care. And then the bottom one, which is continually assess outcomes and refine processes and trainings based on those analysis, and then make changes to those. So just kind of another little note that how we kind of see ourselves. Okay, so now that you have that context, let's go ahead and move into like how we've kind of woven all these ideas, evaluation methodology, et cetera, in. This is a very simple chart, a little Venn diagram, which really just, this was sort of like the how I started in my brain thinking about this presentation. Is there's a lot of overlap, evaluation methods, quality improvement, performance measurement. Research also can be in here, but once again, I was like, that to me is a little bit different. So this is just kind of the frame which I was kind of working with. For me, this is how I kind of see it. Like evaluation at its core is something working as intended. We're looking at this thing, is it working how we expect it to? So quality improvement initiatives, they aim to change a process or a function so that there are better outcomes. So therefore, when we're evaluating these initiatives, we're really looking at, are they working as intended? And if they're not, we need to change and then reevaluate, et cetera. And so then, all the evaluation methods really can help also pinpoint in that improvement project where things are not working and how to tweak them to make them work better. And then performance measurement, we're identifying key metrics, KPIs, key performance indicators that we need to monitor. And why are we monitoring things? To make sure things are working as intended. And so it's sort of, to me, this all kind of fits in the same sort of larger bucket. And then same thing, the evaluation methods help us first identify what those key metrics are, and then also to prioritize them. So this is kind of a more practical example of how we started thinking about this in the beginning, working a lot with our Center for Quality and Safety. So this is just a diagram of potential stages of improvement planning. There are many other ways to do this. But if we think about improvement science uses a lot of fishbone diagrams and key drivers. And so those are kind of their tools, but we can merge them more with more evaluation tools about program theory and logic models and data plans. And so this is kind of how we see it. And so here is an example key driver diagram. And this is a fake example that we use in training about a pizza restaurant who's had really a lot of cancellations lately, because everyone can relate to pizza. So it's easy to understand this. So basically, they're losing a lot of revenue. So we generate this pretend key driver diagram. So basically what happens is this is kind of our simplified logic model. So we could take these interventions and put them into our logic model. And then in turn, after we develop the metrics, we take the metrics and we put them back into the key driver diagram. So it really helps, just that process and be able to kind of identify those metrics. And so how do we kind of start? And as Brad mentioned, Jennifer Carlin, who was my boss, really had done years and years of program evaluations. She was a social scientist by training. And she was a teacher in our School of Medicine, in the Northwestern School of Medicine. And so she really brought a lot, like she was the reason a lot of this started. So really the first kind of formal step that we took was she had started a blog. And so it was really focused on overall analytics, but definitely wove in a lot of evaluation work. So here's an example of one of her blog posts about the logic models. And so that was really, really kind of the first step. And then she also developed a course. It was called Leading with Analytics, and it was mostly geared at sort of mid leadership in the hospital. So think like directors and things like that. So once again, it was much more broad analytics, but you can see here in the learning objectives that there are definitely evaluation methods and principles that she would weave throughout this. But this was pretty small, right? So you had to sign up for the blog. This was 12 people at a time. And so in order to sort of get a larger audience, we teamed up with our Center for Quality and Safety, who have what's called improvement scholars. And so what this is, it's a course, there are two kind of different ways they do it, but essentially 10 courses, and it's interdisciplinary. So it's not just targeted at leaders. It could be anyone really from the spectrum throughout the institution. And they teach basic quality improvement science principles. And there's one session that is devoted to program theory and logic modeling. So that's concrete, but then also I feel like, as an evaluator, one of our main jobs is to listen, right? Like you listen, you gather information, you synthesize that information. And so we really also try to teach that in that course and let people know that, doing a logic model is not something you do at your desk by yourself. So it really is important to get other people involved. It's helpful to have a third-party facilitator. And so we do talk a lot to the scholars about those. And so through this, we have probably trained over 350 people. I actually have another session this afternoon. This is very well timed for that. But it's been really great, and the feedback is really good. We just really kind of go over a very simplified, there's 1,000 different logic models, right? But this is sort of the one that we found has worked best. So we go through this with them. We do a concrete example in the class about getting patients discharged sooner, which is very salient to most of the people in the room. And then we have them do the same thing with our fake pizza restaurant example. So in teams, they go through, they make a logic model, then we review it and go through that. So it's been very, very good. Like I said, there's been really good feedback about our sessions. So that's sort of, in a formal way where we're at right now with regard to how we are teaching and whatnot. Okay, so next let's get into some examples of what we have done in the past. And I'm going to start way back in actually it was published in 2018, but it happened before that. So one of the things that Jennifer had done was our hospital moved locations in 2012. And there was a lot of effort put into the design of the new hospital. And so we wanted to evaluate that and to see if that was the case. So we did this study, we did some work pre and then post and did, things like cortisol levels and all kind of things. And basically the bottom line is that we did find that children experience less anxiety in the new facility. However, none of those effects were lasting because hospitalization is still traumatizing, but alas. So this was a really concrete application of some evaluation work. A couple things I'll go into, not in tremendous detail, but so Integrated Care for Kids grant, which Brad did mention at the beginning that we're working on. So this is a grant from the US federal government, the Centers for Medicare and Medicaid. And what we're doing is basically creating a clinically and socially integrated network. And we are responsible for the care of children in 2 of our zip codes on our west side that are Medicaid patients. And so in preparation for that grant proposal, there had been a huge amount of work done, Jennifer and I and many, many others, to create a logic model for that. And so that grant, we're about 4 or 5 years in. So we've been working through the different parts of the logic model. First, obviously, was refinement. I always talk in our sessions about how logic models are living documents and that you definitely can go back and revisit them and whatnot. So we refined and we're just working on some of the different metrics involved in that, which are, a lot of quality improvement type metrics, like getting kids access to care and things like that. And then people definitely come to us now and ask us to help. And so the next example is our nursing department has a lot of equity, diversity, and inclusion initiatives. And so they wanted to know basically like, how do we know if these are working? How do we know if they're successful? And so we're still in the process of doing this right now, but that's been really great to work with that team. And then we about probably 2 years ago now, maybe even more, we implemented social influencers of health screenings, first in our inpatient populations, and now we're expanding to our outpatient populations. And so basically what this means is when patients come into the hospital, they get asked questions about housing and food security and finances and things like that. And so we are also doing a logic model for that. That's finished, but the interesting thing with that is, that outcomes sometimes are really hard to pin down, right? And so this one was especially difficult because our outcome really is we want children's lives to be better. So that was kind of really showed the importance of finding metrics that you feel strongly can lead to your outcome, because we can't necessarily wait around for 20 years to find out if the intervention we did because we learned a kid needed housing came to fruition. So those have all been very concrete examples of logic. So the next example I wanted to talk about, and I kind of mentioned it earlier, is the evaluation of our high reliability organization. And so we developed a logic model and identified strategies in kind of these three areas: develop leadership, create a culture of safety, and then gathering, monitoring, and sharing data. And so really the first two are, I would say, obviously the second one is culture-based, but really to develop leadership is a lot of kind of culture change also. So our Center for Equality and Safety has done a great job. We have like safety coaches that are self-nominated that then are in the different units and divisions. I think one of the really neat things, and it's very much an outcome of this, was that we have a program that where you can identify a near miss, and those are actually celebrated. And so that really changing that culture in the organization to basically say it's okay, right? Like we can learn just as much from a near miss as otherwise. So we've done surveys to assess the culture, and then also the transparency with the data was a very important aspect of this. And so gathering the data and monitoring it. So basically, as a result, they developed something called a patient safety index, and it's shared widely on a monthly basis. And when I mean widely, I mean very widely. So we have at our elevators digital screens, so it's on digital signage all the time what our patient safety index is. It's shared at the beginning of various meetings. So it's very much, this has been checked off, right? Like they have made that change. They've made the data transparent, and then they keep growing. Once they've sort of finished one, they add new items that are patient safety related. And then the employees are now surveyed on a regular basis to measure that acculturation. And the last survey showed that more than 4 in 5 respondents indicate they know who to go to if there's a problem. And so once again, that's really an important part of sort of the safety journey, is that feeling safe as an employee to do it. So this was a really great use of evaluation methods. They were very open and a great partner. And then the next, which actually ties into the high reliability organization, when we think of performance measurement. So we have a SharePoint online site right now called AllView. And the idea is that this is where our key performance measures are. So this is just a little snippet from the top there, but I can say that we have metrics that you utilize over 30 data sources. We've had over 2,500 unique users and over 66,000 site visits. So the idea behind this is, once again, we're monitoring and really evaluating. And I'll talk a little bit about this in the next steps, because I think there's a lot more that we are going to do and want to do that will really make that tie between actual evaluation and just the showing of a number more a tighter tie in there. So the other really neat program, and I would say if this is interesting, these folks might be another good topic later on at some point, is Catalyst. And this really started after Jennifer had kind of left, but was very much some of her work. And so while this sits in our research institute, it very much serves more than just the research community. And so I'm not going to go through and read all this, but it's basically a really interdisciplinary group, focusing a lot on research methods, but also a lot on program evaluation as well. And they provide services, but they also consult. And so they've done, I just have a few examples here of what they've kind of done over the last few years. So we have a Center for Early Childhood Health and Wellness. And so they worked with them to, and this is obviously not complete, this is just sort of an example, but they worked with them to really put this all together to help them really plan their program and help to develop those metrics for success and whatnot. So that was one way that they really worked within the hospital. So they've also worked with some of our teams throughout the hospital, some of our divisions. So this is some work they had done with our palliative care team. And this shows kind of that they've, gone through iterations, like they did a pilot and then they did a follow-up and came up with some really great recommendations for overcoming challenges in this department. And so they did surveys and whatnot for this. They do a lot of great work. As you can see, I feel like they do a really good job also reporting out and making things really nice nice to look at, which I love data visualization, so it always makes me happy, which I think also this kind of shows. So this is fun, and I think will resonate with a lot of folks after, during COVID, people were remote, people have been staying remote. And so they did a survey about remote work specifically in the Research Institute. But you can see here that they showed, I think, what a lot of people, anecdotal information turned into real information, right? And so they were able to show that people really obviously are very happy with work-life balance. The faculty felt like the productivity was pretty much the same or even improved. And so I think this really was a lot of fuel to keep people, allowing people to keep working remote. So that should give you a little bit of an idea of the breadth of the work that they do. They do a lot, like I said, a lot more than this, but this is really kind of a couple evaluation pieces. So what's next for us? So as I mentioned, I'm very new in my role as Senior Director of Data Literacy. And so we are developing a whole program that's really started with this first Data Literacy 101. And this is something we launched. We did a soft launch back in January of this program. And it's really aimed at getting people to kind of speak the same kind of data language. And it's really, it's really just the tip of the iceberg. And we have a lot more work planned for this. We, of course, are going to evaluate ourselves, because how could we not? So here's our data plan for that. But I will say that moving forward, we have a lot of, sort of role-based programs that we're going to be doing that are going to be getting into more evaluation methods. I actually imagine creating a course that is specific to logic modeling, because I think it's really a concrete skill that people can pick up on, and it really helps people just orient their thinking in a good way. So we're excited about that. The other changes that we're actually going through, like a ton of changes in our department. So that's the data analytics and reporting, and we're creating a modern data platform. And so what that means is that our data are going to be more curated so that people can access it more easily. So that's part of the reason why that data literacy is so important, and why I think really teaching people how to evaluate and to monitor and interpret is very important, because we're going to be sort of letting people access information on their own. So we need to teach them how to use that information in the best way. Another way we're changing, which I'll try to explain this succinctly, is we're moving towards treating data and data assets as a product. And really, I actually think this is very evaluation-y. So what we're going to be doing is we'll have certain individuals that are kind of actually act like external evaluators, that they will be more enmeshed and have a deeper understanding of how our organization works, division by division. So for example, say in our hematology oncology department, we would have someone who really knows, what their workflows are, what their needs are. So very similar to being an evaluator, right? Like I mentioned, it's very important to listen as an evaluator. So it's really the same thing. Like we're going to be doing a lot of listening and synthesizing and really helping people identify what they really need to make improvements. And so once again, we'll say, okay, what do we, we'll create these metrics and then monitor and say, are these things working as intended? And then go from there. And so we're really excited about this. And like I said, I don't think anyone would make that connection that this is sort of like being an evaluator, except someone who's kind of works in both worlds. But we're really excited about that. And also, we are really planning on revamping our AllView. So our modern data platform will give us the opportunity to be more agile and create outcomes and metrics more quickly, and be able to cascade things down. And so that a certain unit in the hospital will be able to monitor their own information more quickly and be able to evaluate that and come up with, changes that they need to make in their workflows or other processes, things like that. And so we're really excited for that. This, it's going to take a couple years to get this all kind of nice and pretty, but we're very, very excited about it. So, and that is all I had for you today. So happy to move on to Q&A, answer any questions you might have.
Thank you very much, Tracie. That was really, really interesting to see all the different dimensions and facets of the evaluation and data analytics framework that you've put together and the program you put together, and lots of leverage for learning within the hospital. So thanks very much.